Thank you all for joining us on Public Square. I want to start with Lily and Michaela and talk with you because you're both moms. What was it like to initially get on Medicaid? Was it difficult?
For us, it wasn't difficult, but it was much more of a relief when we were finally accepted. At one point, Medicaid was taken away because we were starting to receive child support payments.
What did you do?
I had to scramble back to the office and, plead that I would have Medicaid again for my son and I, and it went through and it worked. So luckily we didn't have to wait too long, but then again, it's just the whole application process that takes days. And
Now, do you have to redo this every year or every
5 to 6 months, yeah.
What's the process like when you have to go recertify every 6 months? Is it on the phone or is it?
So you have to go in person and fill out an application, and after you wait for a phone interview, you have the option of going having a phone interview or in-person interview. And I like the in-person interview in case there are any extra questions we could solve any misinformation then and there.
How long does that take?
Well, usually just to submit the application, it takes about a full day to sit in the ISD office.
So a full day?
Yeah.
A weekday?
Yeah.
What if you have a job or school or
That's the
childcare?
thing. Yeah, well, I usually just take my son with me, and we just have to sit and wait.
Well, that must be fun for him.
Not necessarily, but
yeah.
we're used to it at this point.
Michaela, you've also gone through this. Can you talk a little bit about the challenges you faced?
The first time around with my daughter that's almost 6, I wasn't working full time. I was able to manage it, but it meant multiple visits to make sure I was turning in the right kind of application with the right information. And part of what's been challenging to me is actually like what Lily's describing wasn't my experience. And in many conversations I've had with women and families across the state, it seems like many of us are taking different paths to try to get our kids Medicaid. And that's something I've never understood. Like there's actually different applications. You can fill out the short application or the long application, but you put strategies into place. You say, how early can I get there? If they open at 8, if I get there at 7:15, maybe I'll be one of the first few people in line. And then you go in line, and one of the things that I've always been surprised by is that instead of a receptionist, it's a security guard with a metal detector. So before you enter the office, you and your kids get swept down with the metal detector.
What's the effect of having that?
For me, it feels like I'm being treated like I'm not deserving of the care I need, and that there is a reason to be suspicious about who I am and who everybody else is that's there to seek care for their family or resources for their family.
You both have had gaps in coverage occasionally where they weren't insured. What is that like?
It's scary. I mean, there's no way to do any preventative care, so usually you would have to resort to emergency room for basic, fevers and stuff. It's like 8 to 9 hour waits, and in that time, he doesn't feel well. He would rather be home. I think having health insurance is nice because you're able to make an appointment, have a set date, become familiar with your practitioner, and just be able to follow up with that same person instead of like sporadically meeting different doctors through the emergency room.
Michaela, do you?
In my situation, my daughters have 2 different fathers. So when both of my daughters were up for what I thought was recertification last summer, I kept trying all sorts of numbers. I called so many community health clinics that said they had people that would help you enroll in Medicaid, and I tried to get an appointment somewhere to ask which income from which fathers counted for my family situation. And to say, clearly my 5-year-old, her father and I aren't together, but he's responsible, he's hardworking, he gives us child support every month. I wanted to know, do I include the income of both myself, my current partner, and the child support for hers? Because I didn't want to mislead the state or keep income out of what was a true reflection. But it took me weeks to find out whose income I should include. And then I thought I was recertifying my 1-year-old who already had Medicaid if she still qualified. And so I sent the recertification paperwork I thought that was going to both of their applications. But I never heard back that she was denied because I sent in the wrong paperwork. So I went to take her to care, and they told me, it appears that your daughter doesn't have Medicaid. And I said, what do you mean? So no one ever told me that my daughter was out without Medicaid until I went to get there. When I discovered that, I was terrified. Like little things like taking her to the park, whereas before I might have let her run with her restless spirit and her adventurous side. I would hold her hand up and down the slide because I was terrified that something that happens to all toddlers when they bump their head on the corner of a table or otherwise would send us into debt for a medical emergency we couldn't handle. And the biggest surprise to me came then when I figured out that she wasn't Medicaid qualified. I thought, okay, I can just go out and buy her insurance immediately. But when I called an insurance broker, I was told there was one plan in the state that will cover your daughter on her own, and here it is. And the only decision I had to make was which premium I could pay. And of course, on our limited budget, I chose the lowest premium, so we're still terrified. And recently, my five-year-old...
Because you'll have big deductibles.
Because we'll have...
If
so
anything happens.
Basically, like insurance we're saving for an emergency. We're not taking her right now to all the well-child visit. I look at the guideline and I say, I'm going to try to make half of these.
Can I ask our other guests, what does that mean for a child that's only getting care on an emergency basis?
You want the baby from child, birth to their early adulthood to have a good source of regular well child checks. If you look for developmental delays, you can address those much better earlier than waiting until you discover it, like at school or things like that where they have screenings. And then you keep them on track with immunizations, and then you do a lot of preventive care to make sure that they're healthy and developing well, and it really makes them ready for school and ready to learn. So to have these gaps in coverage and times when you go without, it's really putting the child at a disadvantage, and then it impacts our state because then our kids are struggling and left behind, and we're trying to make up for that all the time.
These are two very bright, articulate, I think assertive young women who are advocating for their children and are running into all of these problems with the bureaucracy. We have so many people that don't have high school diplomas or GEDs that I think could be very intimidated by a bureaucracy. And I just can see where people could just give up, even though it's available, that it's just so complicated. And then the negative health outcomes and negative educational outcomes we have because someone couldn't get an immunization or a well baby checkup. It's just appalling.
So I gather there are a number of children who are eligible for Medicaid.
Oh, yes. I mean,
But they're not on it? Why?
Well, I think part of it is just what we're talking about here. It's so difficult. If you can't get off of work, if you're going to have to spend an entire day and then you're going to lose your job or you don't, I mean, just all of these pieces or understanding how to go about accessing the system, I think is just very difficult and very complicated. It is not an easy system to maneuver.
Go ahead, Srisha.
So there are 40,000 kids in New Mexico who should be on Medicaid and who are not on the program right now.
40,000.
40,000 children who should be on Medicaid, and they're not getting it precisely for the exact reasons that Michaela and Lillian have talked about.
But Paige, wait, a lot of the Medicaid dollars are federal dollars. They're all federal dollars.
Well,
No?
for children's Medicaid, the federal matching rate for the dollar spent on Medicaid is about 70%. And then 30% is what the state is spending.
But why
for the
not
first
enroll
3
more
years.
kids?
I do think that the state probably thinks that there is a cost issue and probably sees it as a cost issue, because even though the federal dollars are covering 70%, that 30% is still a chunk of money that it will have to pay to cover these extra 40,000 kids. However, I think that that's money well spent. Because if you don't invest those dollars in kids' health care coverage, those kids will develop what Michelle was saying, these chronic conditions that will become more expensive to the system later on.
To invest in early care and learning, investing in health, it's an investment that returns in a healthy, contributing citizen. It makes sense.
You could get your kids on Medicaid, but is it a big deal if the parents don't have coverage to the kids?
So it's a huge deal. Kids are more likely to get coverage if their parents get coverage.
Why is
and
that?
Because I think when the entire family can do something together, it's more likely that the entire family will actually do that. So if a parent has coverage for themselves, or if they're told by a doctor, for example, you can get Medicaid, when they go into the ISD office to get Medicaid, they will find out that their children are also eligible for coverage at that time too. So it's really around a point of access.
When you have a primary care physician or a care home like, say, First Choice, where you see the same doctors every time, you're more likely to go back because you're having a positive experience and the parents are getting that access to care and having that positive experience, so they'll bring their children when their children get sick. When the parents don't have that point of access, or just accessing care through an 8-hour visit to the emergency room, they don't have that thinking that healthcare is something good and positive to access.
So besides being a mother, I'm also the policy director at Young Women United. In a recent study we did, the majority of young people sampled, 120 across the county, preferred to receive services at a hospital.
Why?
For us, it comes back to health literacy. So I think back to your original question of why does it matter to have parents enrolled? When you see adults in the home practicing health literacy, making thoughtful decisions about what the best place is for them to receive the care they need, then that gets passed on. That knowledge is passed on generationally so that young people know what accessing care means, what it means literally to like find a phone number and call and make an appointment. Many of our young people don't know how to do that because when their parents don't have care, they've never done that. And within just the last 2 years, when I had family planning Medicaid after I had my daughter, I was in a room full of professionals and advocates and doctors who looked at me and said, "But you have family Medicaid, that's all a young woman needs." And I
You mean
was
family
taken
planning
aback. Family
Medicaid?
planning Medicaid.
So your only
So
health
they
needs are
basically told me
reproductive health.
all I needed was access to birth control. So one, what I heard is, you're trying to make sure I don't have any more kids. I haven't had a vision exam in years. I haven't had a dental exam since I had pregnancy-related Medicaid, which covers dental. I said, how can I be a parent that my daughter needs if my healthcare needs are met? I'm more than a reproductive system. My child's outcomes are dependent on my health.
I mean, how do you deal with all these myriad of issues in a community clinic?
We are there for people when they have insurance and when they don't.
You trying to instill sort of this idea in
Yeah.
people like come
Take
here.
advantage of the prevention because it's more cost effective, plus it's better for your health. So, for example, there's a huge rate of hospitalizations for asthma, and it's little kids getting asthma attacks. Now, that's a completely preventable disease. And the way you prevent it is by seeing what's going on in the home. Are there allergens? Are there things that are triggering the asthma? The best place to find that out is in that relationship that you have over a long period of time with the same doctor, saying, so where are you guys living now? Were you guys able to change out the carpet yet? Did you work with your landlord to, repaint and things like that? Because that ultimately will keep that child from having an asthma attack. Same with other preventable kinds of things. So getting them in early and then establishing that as a routine, that's what we're all after here. And it's not been possible because of the difficulty of getting kids covered.
And Roxanne, the Native American community faces extra challenges.
The relationship between Native Americans and the federal government is very different. And so in exchange for millions of acres of land, Native Americans are entitled to an array of social services from the federal government, and one of them is health care. And we describe this as the federal trust obligation. So interestingly, Native American children and adults are entitled to health care, but the primary provider of healthcare is the Indian Health Service, and it's woefully underfunded. It's funded about 54% of the actual needed amount, and very reliant on third-party reimbursements, particularly Medicaid. In an IHS setting, you're going to get multiple services. It's really designed to be sort of a one-stop shopping. So you would potentially go in and get labs done, you might get pharmacy services, and you'd see your provider all in one visit. So potentially the care can be much better. The problem is access. Because we have an IHS facility here in Albuquerque that's supposed to serve all the Native people that live here in Bernalillo County and the neighboring tribes, and there's just no way that facility can actually provide services to all those people.
What are other options then if people, especially Native kids who might be in rural areas, or they can't get into an overstressed system here?
Well, that's why Medicaid is so important to everyone, because when you have Medicaid coverage, you have a lot more options in terms of where to seek services. You're not limited to only going to IHS, so potentially you could go to another provider. If you're in a rural community, I think that's where all of New Mexico, we really struggle because there are areas in New Mexico that are very remote, and maybe you'll have a primary care clinic, maybe an urgent care clinic, but if you need any kind of specialty care, you're going to travel a considerable distance. And if you can't access transportation or you don't have money for gas, that's going to be a significant barrier.
So is the expansion of Medicaid and also the creation of this healthcare exchange and the Affordable Care Act going to make any of this better?
I think it will make it better. I think it will increase access, but I think it's also going to create a burden on the system. And if we don't have enough, if it's not staffed appropriately, if some of the bureaucratic roadblocks are not streamlined and really looked at, I think the other issue will be adequacy of providers, that there will be enough providers. I think there's some places in rural New Mexico where you have providers who will not take Medicaid.
So we have been gearing up for years. So it's going to be a tricky place and time where more patients, and then we finally can hire another doctor to serve them, and then more patients, and it seems crowded, and then we get to hire another doctor. But we can do this. And it's no reason not to cover people. So cover them first, and then the provider system will respond.
I mean, the number one focus is health and a healthier, citizen. But I think overall the issue will help the economy because it does create jobs.
That peace of mind that you have with coverage, knowing that if something goes wrong, if you do have to go to the emergency room, you're not going to get stuck with thousands of dollars of bills. Because medical debt is actually one of the leading causes of bankruptcy around the country. And I work with individual consumers from time to time who are really struggling with huge bills.
We are in debt because of medical bills. It seems like it just so happens that there's times where my son fell sick and we happened to be out of the state, and we happened to be in a state that didn't accept Medicaid. So now we're stuck with a few bills that are over $20,000 right now.
Well, how are you guys handling that?
Right now, being a student, there's no way to handle it. There's just, you have to just file the bills away, and you have to, prepare when there is a chance to pay.
So now you can't pay the bills. So now your credit rating goes down.
Yep.
Then when you try to apply for any kind of credit situation, you're going to pay a higher interest rate.
And I want to address two issues that we sort of generally talked about. One is the enrollment outreach for both the exchange and Medicaid. To my knowledge, the state isn't going to be doing any advertising to let people know that they're eligible for this new Medicaid expansion coverage.
They aren't required to under the...
They're not going to be investing any money towards it. They might do it through other means, but they're not going to be investing any money towards it. And which is disturbing because nationally the statistics show that 83% of individuals who are eligible for this expansion Medicaid population don't know it yet. A lot of these folks are going to get enrolled by their clinics, or they might get enrolled when they go to the emergency room. But these people shouldn't have to get sick before they get covered. And the other issue is that this Medicaid expansion, just to give people a picture of who this is going to cover, it's adults between the ages of 19 and 64. And for an individual, that income cap is going to be about $15,000 a year. And for a family of four, that's $32,000 a year. Otherwise, they'll be eligible for health insurance coverage on the marketplace, but that coverage that they get, the plan that they buy, the tax credits that they get might not cover the best plan for them, and they still might have some kind of higher deductible that they're going to have to pay. So they might wind up in a situation like Michaela, where they're not seeking coverage because they have to cover a higher deductible in order to obtain the insurance that their family can afford.
So now I have one kid on Medicaid, one kid that's by herself on a tiny plan in the private market, like on a little island of a plan. And then I currently have Loveless state coverage insurance through my employer. But that program is ending in December. And I have still not received a single communication letting me know that the coverage I've relied on for the last couple of years is ending. I want to start exploring. Maybe my daughter and I, and all three of us, can get on a plan together, and maybe by pulling her off of Medicaid, she'll get less care, but the rest of us will get care that's more affordable because we're a larger family. Like, I have no idea what we might be able to navigate. And when I asked SCI that, she said, when you end, there'll be new options for you. And I said, do you have any sense of what that is? Is Loveless going to offer me private plans to purchase from? Is it a version of Medicaid? She said, we can't tell you anything now. You can check back with us in the fall. So that's really terrifying to me. I'm trying to picture what my family scenario might be so that we can all get care. And like over the winter, my oldest daughter, Medicaid coverage, got a middle of the night case of croup. And I had never seen croup personally. She comes to my bedroom, she can't breathe. I'm trying to be calm, she's somehow calm. I call Nurse Advice Line, the handiest thing I think for parents both uninsured and insured. They let you know help you assess that decision about where to get care. And immediately they said she needs to be, I can hear her lack of breathing on the phone, she needs to get to the ER immediately. And so my daughter was well taken care of at the UNM emergency room, but when we walked out of there, I was so relieved that it was the Medicaid covered child that had gotten ill and not the one that was on private insurance. And I felt so guilty as a parent that I was relieved that my poor 5-year-old had to go through this.
And there's an option for the state in the future to take a look at a basic health care plan option that would take the money that basically would be spent on for these individuals through the tax credits and buy insurance for them and cover some insurance for people up to, say, 200% of the federal poverty level instead of the current lower Medicaid eligibility rate. And that might create more options that would be more affordable for individuals who don't have necessarily the ability to pay these higher deductibles or higher cost sharing. And so that's something that the state has put off looking at, but we advocate for them to take a look at in the future.
And I did want to add, just like Medicaid is treated differently for American Indians, so is the exchange. So if you're American Indian and your income is up to 300% of the federal poverty level, so like about low 40,000, right,
Yes.
for an individual, there's no cost sharing if you purchase your plan through the exchange. So you'd pay a premium and you could receive tax credits to assist you with that premium, but you wouldn't pay any copays or deductibles. So that's a significant opportunity for lower income Native individuals and families to acquire coverage. I just want to add one thing, because one theme I'm kind of hearing through our conversation is that what we're facing here in New Mexico is a lack of political will to invest in these programs and aggressively reach out to people who are eligible for them.
Well, we're going to bring in our leadership folks and talk more about what we need to do now to make sure kids are covered and getting health care. So thank you.